Okay, cool. Dr. Celesté Van Drunick.
Hi.
How are you?
Good, and you?
Lekker. Tell me, okay, what are you exactly? Because I know roughly what you are and what you do, and I still battle to explain everything.
Yeah, it's quite a mouthful. So my official, let's say, qualifications or so I'm a doctor. I studied medicine. And then I did a specialization in obs and gynae, so that's obstetrics and gynecology. So I'm a gynecologist and obstetrician. That's like sort of one thing. Usually you're an OBGYN in America, they call it. And then I did some extra training, 2 years of fellowship, what they call training. It's a subspecialization in gynecologic oncology.
Yes.
That's a mouthful, and that's gynae cancer specifically, which I subspecialized in.
All right.
Yes.
Yeah. So that is a whole.
Yep.
It takes a while to explain what you do.
Yep.
Okay, but you effectively now you help women with cancer.
Yes.
On their reproductive system, effectively.
Yes.
And that is what you are sort of aiming to rid the world of cancer and help people get themselves healthy and all of that.
Yeah, so definitely the gynae cancer, and I also do general gynae work. So general gynae work would just be young teenagers coming for their first gynae visit, or your annual pap smear, or your, I'm having hot flushes because I think I'm going in menopause, maybe early or in your late 40s. I see all of that as well. I love to help women. I'm really pro women's health and quality of life for women. And so obviously the cancer links to that, because the older you get, your chances of cancer does increase. So preventative medicine is always better than curative. And so, I'm very focused on that from, young age. But then later on, then definitely I'm hands-on with the cancer. I'm very, pedantic about quality of life, pain management, and all of that when it comes to cancer care.
Nice.
Yes.
Okay. So before we dive into anything specific, and I've got a million questions.
Yes.
And this is not... I've told a few friends... Okay, hold on. Let's do this first. Disclaimer. This is not medical advice. This is opinion only.
Yeah.
And Dr. Celeste is here to effectively... The answer to everything is go see your doctor.
Yes.
But we're going to chat about some things, and she can just give her opinion on it, and we've got to do the legal thing, otherwise there's going to be someone who's going to jump up and down and go meh, 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 meh.
So we can only so just to jump in there, so I can only give an opinion today, but if somebody comes to me with a certain problem, I need to go through their full medical history. I need to examine them. I need to do some investigations. So that's why we cannot say you cannot make a diagnosis maybe on today's opinion or whatever. So take it with that, and if you have any questions, come and chat to me.
And that's exactly what you did with my wife.
Yeah,
I said
exactly.
to you, hey, Lee is this age, and
what do you think
can
we should
she have a baby still? And you were like, well, she needs to come and see me.
I said, well, maybe,
guess.
but exactly, I need to go through a few things, look at a few things, and make a calculated decision. And that's what you're paying for when you come to me. Is yes, it's maybe just a 30 or 45 or an hour consultation, but I take 15 years of training to make a diagnosis and be able to tell you that. But to ask me off the bat, it's not always
it's
straightforward and easy.
I mean, I have the same thing in my job. It's like, hey, can you fix my computer?
And you have to
probably
I have to analyze.
I'd have to check it first, give me a login or something, and off we go.
Exactly.
Okay, cool. So I've enjoyed this because I've told a bunch of my friends that and people that listen to the podcast that I know, and I go, I'm getting a gynecologist on, and they're like, really? And I was like, yes. And they're like, but isn't your audience predominantly male? I'm like, well, 67% last time I checked is male.
That's fine.
And which is, I think, perfect. And then as soon as we spoke about you coming on, it was about 2 weeks later, another podcast that I watched, which is a business podcast called Diary of a CEO. And he had a gynecologist come onto his show. And I was like, see, other people are doing it. I mean, why not? And then you said something hilarious when you saw the name of the podcast, Grow a Pair. And I was like, it's not a sexist thing. And you...
what did I say?
You said to me, women have ovaries. They can grow a pair of ovaries. And ovaries are stronger than your balls.
Yeah, so I said, actually, that's a misnomer saying or something, because balls are literally, or, testes are very sensitive, and ovaries are so strong, like what they have to go through every month. And women are so strong. So actually it should be based on ovaries and not on testes or grow a pair, But anyway,
and that's what I normally say to people. So when you said it to me, I laughed because I had a few people on, and they're like, oh, it's a guy saying, and I'm like, no, it's not. And I'm like, actually, girls can grow a pair of ovaries and get it done,
exactly.
And then they all go, oh yeah, I suppose we could.
yeah, exactly.
So, okay, cool. So, women's health, I mean, massive subject.
Yes.
We've got a month for it every year. We've got all this kind of stuff. And I think for the majority of guys, even though sometimes I think we get a bit of a bad rap for it, but the majority of guys, and at least my guy friends, are very concerned and very, or want the best for our wives, for our girlfriends, for the ladies and the women in our life, for our moms, aunties, grandmothers, all this kind of thing. We love them. They raised us, they gave birth to us and are, in some cases, the love of our lives and, all this kind of jazz. And we don't know anything. I mean, the bulk of my mates, and I've spoken to a bunch of them and gone like, hey, what do you know about, ladies' cycle? You go, happens once a month.
Yeah, that's it.
Every 28 days roughly. It's something about a lining. We know that. And my wife sends me to the shop and I get confused when I have to go find these tampons.
Yeah.
And that almost is the limit to what we know. And I think this is something, in my opinion, should be taught in school. It should be, the guys should have a class, or I mean, maybe it should just be mixed, but the guys should have a class or something
included in the conversation.
100%. And then maybe vice versa for girls, for guys' health, and it's, so I'm very stoked to have you on. And I think we can, I don't know where we can dive into it, but let's start with like, what is a period?
Okay,
so we can start in the beginning.
I just want to start, before I start there with the heavy stuff, I just want to say that just the fact that guys are now more asking about women's health, are more interested, I think that's such a great shift to where we were 10, 20, 30, 40, 50 years ago.
Absolutely.
Where men were like, oh, I don't want to know anything about this. Like, this is not my department. I think this is amazing that men are actually interested in the health of their wives, their partners, their spouses or whatever. And I think, that can make such a big difference because some women, they just tend to think, it's in my mind, or I'm just going to soldier through it. But, and the husband or the partner or the boyfriend can actually say, well, I don't think this is normal. I heard this. I know I'm not a woman, but I just think maybe we should go and check it out, like you did with your wife or whatever, So I think it's great. So let's start with a period. A period, yes. Every month, we say monthly, but it doesn't have to be every month.
Yeah.
Some people get very stressed if the period's late with a day or two. Period is allowed to be...
I've been there in the past with a girlfriend. She's like, I'm 2 days late. I'm like,
okay.
Oh my gosh.
No, it doesn't mean that you're pregnant. I mean, of course, you're going to be a bit stressed. It could. But if you use protection, we can go into like contraception and blah, blah, blah if you want to. But the thing is, every 28 days, if you're not pregnant, a woman, then the inside lining of the uterus, the womb, we call the uterus, should shed, right? Because it thickens. It's almost like it's forming a little nest for the egg to implant there in the second half of the cycle, so the week 3 and 4. And if the body sees, oh, okay, well, you're not pregnant, okay, let's go next month, we go again, okay? And so then that's how it's shed. So a period is a bit uncomfortable for women. We know that. We call it period pain.
Is your chair locked or is it like leaning all the way back?
I think it's leaning... It's locked.
Is it locked? Okay, cool. I just wanted to make sure. So I've had before.
I don't want to fall.
I end up all the way back. So I just want to make sure you are comfy. Sorry.
No, that's fine. So then the lining shades, and that's fine. So some women should have some pain, right? And it's normal to on day 1 or 2 have some cramping. And if you take like a Brufen or some anti-inflammatory, then it usually should help enough for the first day or 2. And it shouldn't be so severe, your period pain, or women's period pain, that you have to lie in bed, you can't go to work. Then there's something wrong. So first off, I can just start there by saying, partners, if you see that your partner is lying in bed, from the day of a period, she literally has to miss work, school, university, whatever, it's not normal. It shouldn't affect your daily living. Yes, it affects it a little bit. You have to wear products. You might be uncomfortable the first day. You're not going to feel nice. You're going to feel a bit moody. Yeah, sure, it might affect it slightly, but it shouldn't hectically affect your activities of daily living. You should actually be able to exercise. Like if I run a half marathon like on my period, and that's normal. You should be able to. It's not ideal, but you should be able to. So first thing, if you see that your partner is in bed and she's like dying of pain, and it's like you have to go get 50 million pain tablets, warm water bags, then please come to me or tell her, go to a gynecologist, because that we call it dysmenorrhea. shouldn't be severe. And it could be a sign of something more serious, endometriosis, and that's something that we can treat and help the woman with. So I think that's very important to just start off with for the guys.
Well, and that's the thing. I mean, I've had a few like girlfriends or in the past or whatever else where, and now that you say like, their pain is debilitating. Yeah. And I go, hold on, I had someone.
Yeah.
And she was like, this is normal, don't worry. And it was like 2 days in bed, literally skipped university for 2 days. I'm like,
that's not normal.
Are you sure? Daisy, you're not a girl. You don't know what you're talking about. Yeah. This is normal, fine. And I'm like, that sucks.
And a lot of women are like, but I'm just unlucky. I just have a very severe and very painful and heavy, very heavy period. That doesn't have to be that way, and it shouldn't be that way. We need to assess why and try and sort out and then treat it so that you can go on with your life, because you need to thrive. You shouldn't suffer every single month, 3 days out of work or whatever.
Yeah. Okay. So, there's obviously treatments and stuff for that kind of thing.
Yes. So, depending on what the cause is.
Depending on what the cause is. So, some guy watching, I always use Frikkie. He's my guy.
Go-to guy.
My go-to, my fictitious biggest fan. I see him with a mullet and a wife beater, like a white vest.
Yeah, okay, wow.
From Brackpan.
But he loves his mom,
but he loves his mom.
Yeah.
Maybe sees that, no, bro, this is not right. I'll watch this podcast. I'll watch the podcast. Let me tell you about your stuff. And that's what I'm kind of hoping, that somewhere along the line someone hears something here and goes, hey, I can help someone. Or one of my lady viewers watches and goes,
maybe,
I didn't know that.
Yeah,
and you're
that's
a girl.
what I want.
Because we assume you girls know everything about what's going on.
Some women try to be brave, and it's good, because we're very strong. We think we need to suffer, but it doesn't have to be. Your quality of life must be good. You mustn't struggle with that. And there are a few other things that I can go through also for the partners.
Let's go. Yeah.
So the next thing I actually thought of when you mentioned that, like, what do partners need to know, especially more for the men? So let's talk about sex. All right. I'm a gynecologist. Of course, it's going to come.
Yes. We spoke about it when I brought Lee to you.
Yeah, exactly.
Hey, I don't know we're talking about
this.
Yeah.
So for me, it's not all good at all. And I mean, when my patients come to me, the women come to me, I always tell them, you can say it as it is. There's nothing that's weird. Tell me everything. But I think for the partners and for the women listening, if sex is painful for you, it's abnormal. It shouldn't be painful. Sex must be enjoyable, right? Some women have pain in certain sexual positions, and that could be normal depending on how your womb is positioned. And then if you change up the sexual position, it should be better, right? It should not be like you want to jump off the bed from pain. Okay, so guys, if you see that your partner is like literally bearing through sex, it's not normal. Okay, it doesn't mean there's something wrong with you or her, but there could be a medical condition like endometriosis, like a mass in her pelvis, that can cause severe pain that we can treat. Or she might have what we call vaginismus, which is where the muscles actually tense up so strongly that, you can't penetrate or whatever. And it's so painful for her that it's almost it becomes a psychological thing, and the pain cycle just continues and continues. Then you must tell her, listen, it must be enjoyable for you as well. I think let's go and talk to somebody. Let them scan you. Let them examine you. You do a pelvic exam and make sure that everything's fine, because it shouldn't be severely painful. Sex shouldn't be painful. Okay.
Well, if that's the takeaway, then I think
people will be like, okay,
sold.
Should be enjoyable.
Should be enjoyable.
No, it's true. Even if you're not trying to conceive, it just and I think a lot of women, won't say to their partner, they want their partner to be happy. They know it's important for their partner, but it's also important for women to be happy in their relationship and physically be satisfied. And so, I mean, so let's talk about orgasms and all of that. I know that's a thing where men are like, I don't know, like some men are very good, some don't know at all. I don't know. I'm not a sexologist. Yes. I have some training in sexology, but I'm not a sexologist. But I think, if the couple just talks about it, I think it's okay. Some women are okay with not having an orgasm, every single time. If they're fine with it, that's fine. But I think if the communication is there between women, between the man and the woman, that's what I mean, between women as well, then I think, if you know what your partner wants and needs, and they feel they have a need for something, then you try and adjust it and you try and talk about it, I think that's fine. I think if women have never had an orgasm, a real orgasm, and they will know.
Yes.
Not a fake one, they will know. Yeah. They must also go and see somebody, because that's also not normal, right? It's okay to not have an orgasm with penetrative sex. That's completely normal.
Sure.
Some women need a bit of help, whether it be with a hand or a toy or whatever, that's normal. Some women can't, and that's okay. We see a lot. But I think if you've never ever, then there's definitely, it doesn't mean it's like, oh my gosh, there's no hope for you and you can never enjoy sex if you're a woman.
Yeah.
Go and see somebody. I can refer you to somebody. I can talk to you about it. We can see maybe there's a reason. Maybe you have pain. Maybe you have that vaginismus. We can talk about it.
And there's a lot, I think, that goes on there beyond, I think, even just the physical.
Definitely mental.
The mental, psychological side of things also is, you say communication, and that, I mean, if I thought of all the different things that you would have said today, that wasn't on the list of where I thought at least a little bit would go, you know.
I'm glad.
Which is great, because I mean, I'm sitting here thinking now going, okay, hold on. If we start, we'll broaden the whole subject quickly for two minutes, right?
Yeah.
You broaden it and we go into, let's talk about relationship health, marriage health, interpersonal.
All plays in.
Interpersonal health, you know, communication is this huge thing. And then South Africa, we've got this, you know, sort of stigma almost around it, and you're like, oh, you can't talk about sex, you know, and because if you do, it's almost a taboo subject.
Yeah,
it's getting better.
It's getting better, but I think that, you know, definitely the older generation, they're like, you don't talk out of the bedroom, you know, that type of saying, and I think that's changing, but people are still awkward to say. So I ask my patients. I go through a list when they come to see me for the regular checkups or whatever, or even if they have a complaint of something else, then I go, how's your sexual life? Are you sexually active? Yes or no? Yes, you are. Are you happy? Do you have severe pain? Do you have bleeding after sex? So, by the way, that's completely abnormal. If somebody is bleeding after sex, a woman, that is not normal. They need to see a gynecologist. Okay, we need to make sure there's nothing there. It could be due to different reasons, but the dangerous stuff like cervical cancer or a pre-cancer is something that we need to rule out. Or an infection, you know, severe infection, we need to have it looked.
I'm assuming outside of if they're on a period.
Of course.
Like,
yes.
I mean,
of course. But I mean, like, if there's just like a random bleed after sex and it's not your period time, then you need to go to a gynecologist ASAP.
Yeah, that would freak me out.
And it happens.
Like,
I see it. I'm a gynecologist, but it actually is. And some women think, maybe it was just a bit too rough, you know, and that shouldn't be, you know, unless you did hectic foreign objects, you know. I think that's really something where you need to go to a gynecologist.
You spoke about a couple of different conditions that people can have and whatnot. Do you want to dive into like some of those? And
so I think
endometriosis, I've heard the word, and I've known one or two women who've said like, I've got endometriosis, but that for me sounds like it could be a lung infection.
Weird, like what is
like,
it?
Okay, cool, you got a cough, you know, or whatever, you know.
So basically, endometriosis it's not a cancerous condition, but it's really debilitating. So the inside lining of the womb, of the uterus, it's like glands that forms and grows every month and sheds with your period.
Sure.
But they decide, for some reason, these little cells of the inside lining, they decide to grow in other places in the body. It could literally be anywhere. They've even found endometriosis in a lung. I mean, that's so weird.
Interesting.
Yeah.
I wasn't far off with the lung thing.
Yeah, that's
random
true.
guess.
But I mean, that's a very rare and written up in journals. But the issue with that is, so basically, it forms little implants and growths, usually in your pelvis. And every month when you're on your period, those little implants or endometriotic growths or nodules also bleed basically, and they cause a severe inflammatory reaction. And then that inflammation causes a lot of damage, pain, can cause infertility. Your tubes can get blocked, your ovaries can be dysfunctional, you know, can get massive bloody cysts on your ovaries, and these are all very painful conditions, and you can treat it with surgery, you can treat it with hormones to suppress the endometriosis. You know, we don't know the exact cause. Tampons, so by the way, does not cause it. Some people say so. It's not proven to cause it. But yeah, so that's why I'm saying if sex is very painful, your period is very painful and very heavy. Something else that also can cause pain, pressure, and usually very heavy period bleeding is what we call a fibroid. It's like a muscular ball that the womb makes. It's not a cancer, it's just a growth. And sometimes they can cause lots of symptoms. Lots of women have them. You don't have to remove them, but that's one of the other things, or few other, you know, things. And then there's many other things that can also cause it. But I think these are the main things, you know, with the symptoms that we've discussed.
Yeah. Okay. So a lot can go on down there. Like a lot.
Hence me taking 15 years to train for all the conditions and cancers and everything. Yeah.
Good grief. Okay.
Yeah.
In terms of, so you mentioned earlier, you said we'll get to it. Like contraceptives and that kind of, or contraception and that kind of stuff. There's a lot of rubbish out there in terms of myths and old wives' tales, and I've
what's
heard
the side effects or the adverse
and,
effects.
So I've heard a bunch of weird stuff.
What have you heard? Like,
okay, so I remember being a teenager, and this one was the weird one, where a girl in my church was like, she was young, and she was like, "Oh, I'm on the pill," and I was like, well, "Number one, why are you telling me?" I mean, you know, I'm like 15, but anyway. And then she was like, "Oh no, it's for my skin."
Yeah.
I was like, okay. So that was like one that was interesting.
Okay.
Then I knew another girl, and she was a little promiscuous. I was in my 20s, and she was like, "Yeah, no, I'm being very careful. I'm on 2 birth control pills." You know, and I was like,
that's not necessary.
Doubling down. I mean, like, what are you, crushing it and snorting one? And what's the story?
That is not necessary.
And then sort of the other stuff I think that I've heard is that if you are on contraception, you can potentially lose the ability to get pregnant.
That is a very big myth. And I see that a lot of young women come to me and teenagers, they come to me and they say, no, but TikTok says, or this celebrity says that if you're on the pill for very long, it causes infertility. And that is not true.
Not true.
Okay. What causes infertility, there could be different reasons, but in a woman's body, if your tubes are blocked from infections that you get, sexually transmitted infections, that's what's causing the infertility. Or you're not ovulating, you're not releasing an egg from your ovaries every month. For whatever reason, there's different hormonal reasons, or stress or whatever could also even contribute to that. Or there could be a weird growth inside your womb, and that's why you're not falling pregnant. But long-term hormones, even if it's the injection or the pill, does not cause infertility by itself. Okay. Yes, it takes a month or two for your cycle to just get back to itself. A lot of women say, no, but I just want to cleanse myself of the hormones. Well, within a day or two, those hormones are out of your system, because that's why you need to take a tablet every day, right? Okay. So, but yes, I mean, it takes a month for your cycle to be like, oh, I'm not getting anything anymore. Your brain's like, oh, I'm not getting any hormones. Okay, let me see what's going on. And then, you get back into your natural cycle. But it does not cause infertility. So you do not have to be scared if you're on contraception that it will cause infertility. The only thing that will cause infertility if you had permanent contraception, like a sterilization or a male vasectomy, of course.
Sure. Yeah.
That was the point of it.
Yes. Okay. All right. So that's all right, eye-opening.
Yeah.
I'm trying to think what else.
I have something important that I want to add to that. So we talked about the, sexually transmitted diseases and infertility, because it can cause infertility. Something that I now recently did a talk about is the HPV virus. Have you heard of it?
Okay, so I've heard about it. Absolutely no idea what it is.
Okay, do you know what
I've heard the words like somewhere,
somewhere
like on
along
a video or a radio station they're talking about
HPV.
It or whatever else. HPV.
But you know what? The irony for me is, you know what HIV is, and HIV, yes, is a chronic condition, lifelong, and there's so much coverage about HIV, but HPV causes cervical cancer. Okay? Cervical cancer can be prevented 100%. We know the cure for cancer. For cervical cancer, it's the HPV vaccine, okay? Or just not getting the HPV, okay? So HPV is human papilloma virus. It's like a virus.
Sounds intimidating.
Yeah, it's the same virus. It is quite an intimidating virus. It's got like a family tree of more than 100 of these viruses, right? You also get warts from them, okay? You can get normal skin warts, when you're young, you're a child, you can get them. That's a different type of, different types. And then you get genital warts from them as well, type 6 and 11, whatever. There's many different numbers. And then you get high-risk ones that like to live on the cervix. The cervix, just for the guys, is the opening, so the lower part of the uterus. The cervix is almost different to the uterus or the womb. It has its own type of tissue. It opens and closes during the birth process, if going into natural labor. And that's where we get cervical cancer. And that's what a pap smear is. A pap smear is looking for abnormal cells or HPV, depending on what the doctor chooses to test. When they look, so the gynae looks inside the vagina of the woman. She looks at the cervix. She locates the cervix, and she just gently scrapes off some cells with a little brush. It's soft. It's uncomfortable, that part, for women, when they have to look inside and open up the vagina with that steel speculum. That's not great. Oh, so by the way, that was so funny.
As soon as you said
macro is selling speculums. Why would but I'm going to go look, because for me it's great, but I don't know who else is going to use speculums, at home.
But at 124 rand. right?
That's crazy.
I laughed
That was
so
so
hard.
funny.
I was sitting here because I was so every now and again we have to buy stuff, and we'll look on macro and
Yeah, or
whatnot.
you go scroll through take a lot of macro.
And
Yeah,
I was on Facebook Marketplace when I saw it. And then I screenshot because as soon as I saw it, I thought,
this
is
funny.
hilarious. You're gonna enjoy this.
Because I'm buying one because I'm building my practice. You're
yeah.
buying equipment and stuff. That was quite funny. I laughed so
But I don't know
hard.
why macro would be selling that.
I also don't know.
But I can almost guarantee you. So we've seen it with other stuff. So you find things on macro that you shouldn't. So even for our businesses and whatever
you also
else, we see weird stuff. We're like, yo, that price is okay, or let's check it out. And we try to buy it, and they're like, sorry, out of stock. So it's all listed there. And it might just be some random massive database that they've just imported from all their suppliers, and it's not actually available.
Because it's so weird. I can't imagine that anyone would use that except a gynecologist, like maybe a GP and a gynecologist.
Or some weirdos.
Yeah, maybe. I don't know, like that's weird. Anyways, back to the pap smear. Pap smear is not painful. When my patients come to me, I really try, I talk them through it. So you can say to your partner or whatever, if the men's listening, that yes, most women dread that it's not nice. I mean, it's not nice opening your legs and blah, blah, blah. But it shouldn't be that painful for you. And your gynecologist should talk you through it. You should breathe. And it really, most of my patients, like I want to say 99%, are usually like, wow, are we done? Like, that's how it should be. It should be done. So you should you should feel comfortable with your gynecologist.
That's
just the FYI.
That's exactly the kind of response that I'm looking for when I go and fix a computer problem with my clients.
Yeah.
Yo, that was quick.
Okay, yeah.
We're done.
We're done. We're
painless.
really done. That's what I want. Okay, so that's how it should be. Even if you have like painful conditions like endometriosis, it should be like that. You know, or but so I pride myself in that I make my patients feel very comfortable. But anyway. So if you have not found a gynecologist made you feel comfortable in that way, you need to find someone else. It's not one size fits all, So you're going to shop around. Nobody's going to be upset if you're going to look for a different gynecologist next year or whatever. It's fine. Anyway, back to pap smears. It's important that women from 25 years of age go for annual cervical, well, not annual necessarily, but at least every 2 to 3 years, go for cervical screening. The cervix needs to be screened for abnormalities and HPV specifically. This virus, the high-risk ones, we know they stay there, they change the cells there, they cause cervical cancer. If you can, and you can afford it, or if your medical aid covers it, it's very important to get vaccinated against HPV, because then in the first place, it won't go there. 80% of women and men get HPV in their lifetime. It's the number one STD in the world. Okay, let me just
and it's
say
unknown, but it's not.
Yeah, it's not like I feel it's not talked about enough. It causes cancer. It's the number one STD. Why are we not talking about it more? And that's one of the reasons why I also wanted to come on here today, because people, don't really know that there's a vaccine, or like how do you treat it? Because you can't treat it once it's there and your body can't clear it. You can't give a medicine to take it away, right? Because it's a virus. It's not like an antibiotic that you can just give for other STDs. And so it's very important that, even if you've had sex before and you might have been in contact with HPV, I think it's important that you ask your gynae or your GP about HPV vaccination, even if you're 25 or 30, because we can prevent cervical cancer. You don't know. Most people clear the virus, but about 10 to 20% of people don't, and it stays there, women, on their cervixes, and sometimes on the vagina and the vulva as well, the vulva, the outside lips, okay? And so it also causes cancer there, or just precancerous lesions. And then the poor woman, you need to go through cuts.
Oh, that can't be fun.
No, it's absolutely, horrible for women, and it also mentally and psychologically very difficult for them to deal with, So
how long? So look, post-COVID, the vaccine conversation is so controversial. I knew you were going to go there.
I know.
And so, like for myself, I'm not a anti-vaccine type person, but what I do want to see is proof.
Yes.
Or something. So,
yes.
So
I can give it to you if you want.
So, I look at childhood vaccines, and so I'm a bit of a funny one. I like to do my homework and research and whatever else.
No, you have to. That's good.
And you look at in the USA, and I watched a podcast a while back, they do now up until like 13 years old and a kid, it's like 87 or 97 separate vaccinations in America.
What?
Yeah,
that's
in the
US,
a lot.
It's
insane.
That's a lot.
Right, and that's where the big fight is, on it, So they're going like, hold on. How much of this is just to make money for people? How much of this is real life? You know,
So
you watch podcasts and these medical podcasts, and the guys you find someone that is trustworthy or whatever, or that's got an unbiased opinion, and then they go through it and they're like, okay, well, out of those, like this one you need, this one's been proven. We've been doing it for 172 years.
Yes.
The chance of problems are totally min, and blah 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 blah. HPV, what's the history around it there?
So let me tell you. So I'm not endorsed by any pharmaceutical company. So I've never been paid by anyone. I just want to say
think
that
doctors and like, oh, of course you are.
I'm not paid. I've never, no rep has even been to me yet to say representative to say, listen, please endorse it. I'm doing it because I know what the research says. And the research were not only funded by these big pharmaceutical companies. These like most of the good research that we have are done by independent, universities in the world, and even where at Stellenbosch University, where I did some of my training, there's a Professor Botha there that's on the forefront of HPV and HPV research, and he's not endorsed by any of these pharmaceutical companies, but we believe in the scientific evidence, which is not just what they want, of course it's what they want to hear, but the reason that the vaccine is there is because it works and it's safe. Okay, so more than 500 million of HPV vaccines have been distributed in the world. They've not had any adverse effects like in people dying or having, whatever severe adverse reactions. Mild reaction could be for any vaccine, a bit of pain at the injection site, a bit of flu symptoms maybe for a day. That's it.
If you stick a needle in yourself, you're going to have a little bit of pain.
Okay. And actually you want to have a bit of a flu reaction because it means your body is making the antibodies for the virus or against the virus. And actually, they saw that even in 6-year-olds, you can give this vaccine. It's completely safe. There were few case reports. Now, a case report is like 1 or 2 a case, not thousands of people that are tested in research, that has said, no, maybe it caused autoimmune diseases or Guillain-Barré, which is also an autoimmune thing. Yeah. And actually, they looked at it at all the evidence through 500 million people. It does not cause any autoimmune conditions. Doesn't. Okay. Nice. There was some TikTok stuff about infertility. That's not the cause of your infertility, not the vaccine. The other STDs that you got with the HPV is what caused your infertility because you have tubal damage, if you're a woman. And so, it's completely safe. And the government has put it in the program for all government schools. 9-year-olds are getting it now as part of the vaccine program. But the parents have to sign for it. Sure. And so that's the issue.
Which is good.
It's good. I think it's very good. But I also think the child forgets the paper at home or in their bag. They don't give it to the thing, and then they miss their opportunity, and then then it's done. Sure. But you can at any time take your child after that. And we're not saying that if you're taking your child, that means that your child is one day going to sleep around or be promiscuous. Not at all. You can have one sexual partner that can give you HPV. Let me tell you the amount of women that have come to me and said, I waited until I got married to have sex. I've never had sex before. And now, a year later or 2 years later, I do a pap smear for them. I get a high-risk HPV, and they're like, how? And I say, but you can get it from one sexual partner. And that person might have had just one other sexual partner. Sure. We're not saying, okay, now you can be promiscuous because you got the vaccine. Not at all, okay? Because the vaccine can't cover you against the hundreds of, the high-risk ones there, or ones that they are, but it covers you to the most high-risk ones, the ones that are most likely to cause cancer. And it definitely in 100% of cases prevents warts, so you won't get warts. And you don't know if you've been in contact with HPV yet or not, and if you're going to clear the certain type of strand or not. So I always say, if you can afford the 1,000 rand, go and get one injection. It's actually enough. The WHO now says it's enough. They're endorsing it. They say we need to get rid of cervical cancer. It's a big problem. We have a freaking cure. Like, let's just get rid of it. Hello, guys. Like, people are going to have sex, okay? And people are not going to have it with condoms, unfortunately. So the next thing is the vaccine.
Sure.
That's it. Yeah. And to get vaccinated.
Yeah. I like it. That's good. That's
Great.
Good. I like proof. And it's, look, I'm taking your word on it, but I know you.
Yeah, but I can send you the articles. If anyone wants me, I can send you the articles that are independent of pharmaceutical companies. I can send you this, and 10,000 people tested. This is the this is the effect. This is how good it works.
Maybe you can send me the links and we'll put it into the description of the video.
I'll send you some of that.
Yeah, that'd be cool. That'd be really nice. Yeah. Because, end of the day, and I'm loving this conversation because there's stuff I have no idea about. It's stuff that, like, I would go and discuss with Lee and be like, hey, I don't know. I don't know if Lee's had the HPV. No idea.
Yeah.
I do
That's
not know.
true, hey? And it's, I mean, that's your wife.
Yes,
you
my
know,
wife.
it's a good conversation to have.
No
And when you
idea.
want to have children one day, you want to have that conversation about, you know, when they get a bit older, how do you feel about vaccines and how do you feel about this one?
Back
and
to
of
communication
course,
again.
if somebody doesn't believe in vaccines, and that's completely fine. I'm not going to try and convince them, but I believe it prevents cancer.
Yeah.
And the thing with the vaccine is just one more thing. I can talk about the vaccine for a long time and about HPV because that's gynaecology is a lot about that.
Yeah.
And so the big thing is if you vaccinate yourself, you're not only protecting yourself, and if men must also get vaccinated, by the way.
Okay.
In America, they have now introduced the vaccine. A lot of people have gotten the HPV vaccine, and now cervical cancer in women is rarer than oropharyngeal, so in the mouth or throat cancer for men. So that's not a common cancer at all.
Yeah.
Throat cancer or mouth cancer for men, right?
Yeah.
That's HPV.
No, not that I know. Yeah.
That's now more common than cervical cancer. In South Africa, that cervical cancer is number 1, okay, of what kills young women and that is causing severe disease in women. Okay, yes, breast cancer is also there, but then the next one is, cervical cancer.
Yeah.
So interesting enough, in Australia, because they vaccinated boys and girls, they've now almost eradicated cervical cancer because they started almost 8 to 10 years ago. So now they're seeing the effects there.
Good grief.
Crazy.
So I look at that and I go, okay, cool. That's like polio or something. You know, like
exactly. That is what we want. So
you know, vaccine. It worked. It got rid of it.
Yes, because we got herd. The word here is herd immunity.
Yes.
Herd immunity. So if you're vaccinating yourself, you're also protecting the rest of the world. And other people around you. You know, it's because we're getting herd immunity, and that's what we want.
Yeah. Yes. I love it.
Yes.
I love it. Okay, so getting pregnant is a big thing.
Yeah.
And like this is a discussion that's funny, at least, because you can, I know like loads of people who are like, we're going to have a baby.
Yeah.
And then 5 years later, they're still like, we're just trying to have a baby.
Yeah,
then you get the other people like, I'm not having a baby.
And then they get a baby.
And then they get
I don't know why it works like
100.
that.
Like, the people that are trying, like, and it just seems to be like, maybe it's not the real life, but the people that are trying to have babies, like, okay, we're having a baby. And then it's a mission. And then the oaks are going like, nah, hey, man, number 3 was, mistake baby or accident baby or whoopsie or lot lamiki or, like whatever the story is.
Yeah.
What's the story with having a baby? How does it work? Is it, like...
So when, how...
When, how? Do we need to be having copious amounts of sex all month? That's yes, we need that. I know that's not the answer. But the guys want that to be the
ladies.
answer.
Don't worry. I've got you.
What's the story there?
Okay. So either you're trying to have a baby or you're not, right?
Sure.
Or you're like, oh, whatever, if it happens, it happens.
Yep.
That's great. Okay. It doesn't really matter. If you don't want to have a baby, we'll talk about contraception, and we've touched on contraception, and there's different options. And
we can deep dive into that a bit as well.
We can go into that as well. But you've got we'll get to that later. Let's talk about pregnancy. If you want to fall pregnant now, okay, so very important is that you're not using. I know it's maybe obvious, but not a lot of people think about it. You shouldn't be on any contraception, okay? So stop the pill, okay? Stop the injection,
and
or
no
if you've
condoms.
And no condoms. No, really. It's very important.
You can't tell me that people are like,
Okay. So make sure. I think also start with, you got to trust the guy because you're not going to use condoms, or the woman. So you need so just be in a trusting relationship because you're going to have unprotected sex.
Well, I mean,
and you're going to have a flippant child with this person. So just think about it, and I think it's good to plan.
Yeah.
Because women need to take folic acid. It's a type of vitamin, micronutrient that you need to take 3 months before you start trying to conceive, because it prevents open, like spina bifida, open spinal cord.
Yes.
In babies. We know if deficiency, then you can get that. So it can prevent that. Okay. You make sure your iron levels are fine. You need to go to the gynae actually before you're trying, the 3 months before, and saying, listen, am I vaccinated against rubella, which is, measles, whatever. You need to just go through all the things and think about all of those things. And then when you start actively trying, so no contraception, and then when you're having sex, there's something that we call the fertile window.
Yes.
So if your cycle is regular, the woman's cycle is regular, every 28 days, but it can be up to 35 days apart, and it can vary with 5 days. So if it's 28 days now and it's 32 days, it's fine. Okay, that's normal. Okay, just FYI again. And so you have to work out your general cycle length, and usually 2 weeks before, in the middle of your cycle. So your period is always day 1. Okay, so we always start by calculating pregnancies also from the day 1 of the period, not the end of your period. We just use it that way because it's an event and it's easier to remember. And we've
so
now
day one is you start bleeding.
Start bleeding. That's
okay.
day 1 of your cycle. So usually, if your cycle is 28 days, in the middle of your cycle is day 14. That's where you potentially ovulating. Okay, if your cycle is longer, let's say 35 days, then you have to work back. So you go 35 minus 14 days, 2 weeks, because the last part of the cycle where you've ovulated is always 2 weeks. The first part can be a bit longer.
Right.
Okay, that makes sense. Okay, and then around that day that you have, let's now say day 14 hypothetically, 2 days before and 2 days after is usually your fertile window. So you
got 5 days.
Yeah,
roughly.
Because remember that at any time you can the woman can ovulate, release the egg, and sperm lives in the genital tract up to 5 days. Okay, so you can actually have sex a day or 2 before, and that can even still let you, help you to fall pregnant. Okay. So on those days, I always say every day is good to have sex, but it's also okay if you want to have sex every second day. The rest of the cycle, I mean, when you're bleeding, that's really not necessary. You're definitely not going to fall pregnant when the woman is on the period. But then after every second day is a good, I think ballpark. Every day is really not necessary, except in that fertile window, maybe if you really want to. But also if you skip one night, it's fine. I wouldn't skip 2 nights, not having sex. I'm saying nights, but I mean, it can be any time of the day and anywhere. So I think that's the first thing is important. Also, if your periods are not regular, if you're a woman, it means you're not really ovulating good. And then you need to also get to a gynecologist because it might take you longer to fall pregnant because we know you're not, every cycle releasing an egg and you can't predict it, and it will maybe take some time. So then you're going to do that, or if you want to, you're going to do that. And then if you've tried for a year, usually the time is a year. If after a year you've now really tried without protection, when your fertile period is, you had sex, in your fertile period, and you really haven't fallen pregnant, then I would say, okay, you know what? You need to get to a gynecologist because there are a few investigations, a few things that we need to look at to see why you're not falling pregnant.
And this stuff you can prescribe and do
I
and
can
whatever
prescribe,
to help
and depending, there's so many things that you can do,
Sure.
and we're not going to go immediately to IVF.
Yes.
I mean, we're not talking about that. We're first going to look for the cause. And just by the way, guys, you always say, but I'm not shooting blanks. Should I really go for sperm analysis? Even though there's something coming out, doesn't mean that the sperm looks normal.
Yeah.
And if you really want a baby, it's really not that bad. You just do the sperm analysis if it's really necessary, because 50% of the time, guess what? It is the sperm. It doesn't mean you're less of a man. It could just be that you need to stop smoking, or change your diet maybe, or not cycle all the time because it's hot, and that's the issue, you know. So I think, both needs to be tested then after a year if there's an issue. Just guys, really, it's really, I mean, I know it's a bit awkward for you, but it's really not that bad. It's quick. And
grow a pair and be a man.
Like if you want a child and you want to make your happy wife, happy life, also if she wants a child, then just do it for her. It's just one day. It's really not that big. It's like 5, whatever.
One day and then 18 years.
Yeah.
well, a bit more. Because then they want to become a doctor and study for 15
good
years.
Luck. Please don't. Shame, So that's pregnancy. I think
one question on that. So I know like some people will use lubes and that kind of stuff.
Good question. Yes.
And some of those lubes, from my random knowledge of walking through the aisle at Clicks, they're like spermicide, which, if you go fungicide kills fungus, if something else aside will kill sperm.
So spermicide lubrication is actually it's actually a form of contraception, but it's not a good form of contraception. Okay, it doesn't work very well. So if you're going to just use that and you really don't want a baby, it's probably going to fail after a few cycles, and you will, the woman will be pregnant.
But if you're trying to get pregnant, you don't want to.
You also don't want to use that. So basically, you want to use a water-based lubrication. It's okay to use a little bit of lubrication, but you do get, if you're seeing that you're struggling, there are certain fertility specialized lubrications that they say does not interfere with sperm quality. Okay. And so I'll send you a link for that. If somebody sees now after 6 or 8 months and they think maybe they need a lot of lube, and maybe it's the lube and they want to try something else, but a basic water-based unscented one should be okay. If you're using a little bit, it should be okay. Okay, so it'll also be enjoyable,
Yeah. Okay, so that's getting pregnant. There's a window.
Yes.
And like that, I didn't really know that until we came and saw you.
Yeah,
we chatted about
and
that.
that's why, okay, so you need to sort of try. So I think it's very good for women to track their cycles on an app. We have all have apps on our phones. And it's easy to remember because you will, life gets busy, you will forget when you started or whatever, and it just helps you. It helps you later on when you know when you're pregnant, like how far you're pregnant, and also you can tell your partner, hey, listen,
we're 4 days
we're
out.
4 days out.
Buy chocolate.
Yeah.
What's the chocolate thing?
I don't know.
What is the chocolate thing? Because I've seen some hilarious like TikTok videos, where the husband's like gets this alert on his phone or something.
Yeah.
And he's like,
you can sync it with the partner.
It's period time. And the guy's like sitting there with like, pretending like he's throwing like grenades, and he's like, chocolate.
That's funny. But I mean, I think it's good for a relationship to know, like, okay, she's going to be a bit more moody. Okay. Oh, and another thing, if your PMS, we know it's called premenstrual stress, if that moodiness is so severe, come and see me. I can also help you with that. That's also not, if it's literally you want to divorce your husband or your wife in that time, and it's like literally your marriage on the rocks because of your PMS, it's not normal. Come and see me. We can help you. Like I can help you, or your gynecologist can help you, just FYI. So then you can at least talk about it and say, listen, I'm feeling a bit irritable and I see my cycles coming up. So I'm just saying, like, just bear with me if I'm upset that you didn't take the trash out or whatever.
So contraceptives, we touched on it a little bit, and then we diverged. Now we come back to it. I've been like thinking through all the things that I've heard about it. So contraceptive, the pill at least, or the injections and that kind of stuff, work on a hormonal level from my understanding of it. I watched a podcast a while back with a guy that was talking about it, and he said the hormonal changes can, like, if a woman's on a contraceptive pill or something, meets a person and is madly in love with them, right, goes off the pill, and then actually ends up not liking that person as much. And I get, like, maybe it's not like a whatever thing, but I've heard the story, like, literally, from people who are like, I was on a pill, I met my guy, madly in love with him, we went off the pill to get pregnant, and I can't stand him. It drives me nuts. They have the baby, she gets back on the pill, she's madly in love again.
Really? There's no scientific evidence for that. So those hormones, I mean, well, we'll have to do a study on that. But those hormones really work by either preventing you from ovulating, okay, so you're not releasing the egg, okay, and so it mimics, your body thinks you're pregnant, basically. If I can
so it thinks you're pregnant and goes, oh, you can't now. So,
because there's already so much of this hormone in me, so you must be pregnant. So that's why you're not ovulating, because I'm already have all of this progesterone, in the cycle. So, okay, I'm not going to release another egg. That's very simplifying it, but the other way it works is by changing the mucus of the cervix, because there must be mucus for the sperms to go into the cervix, into the opening of the womb, and to go up, and then the baby gets, like, the sperm and the egg actually meets in the tube, right? That's why you sometimes get tubal pregnancies.
Fallopian tube.
Wow, you know that word.
I know things.
So fallopian tube, and then at day 8 to 10 or whatever, it comes down, and then it implants into the uterus, and that's why only there's about a 2-week wait before you can actually see that you're pregnant on a pregnancy test. Just by the way. So very interesting. So there's different ways. So these are hormonal ones that work that way. So you get barrier ones as well, like a condom or a female condom or a diaphragm that you can put in. That's just a physical barrier that there's no hormone in it. A copper T. Have you heard of that?
I was just about to say. I was like.
So or a loop. So a loop is a little device that you insert into the uterus, the womb, and you get 2 types. You get the Mirena. You've probably heard of the Mirena. That one has hormone in it. It's got progesterone in it. It thickens the lining there, so there's no baby that can implant. Some people don't ovulate. A lot of people don't get a period on it, which is nice and fine. You don't have to, if you're on hormones, get a period. It's okay. Right, but if you're not getting a period, ladies, off of any hormones for 3-6 months, that's not normal. See your gynecologist.
So if you're not on anything, you should be getting a period.
You should be getting a period. If you're not, if you're between your reproductive years, let's say 13 or whatever to 50, from the 50s, menopause, you can start skipping, and then you also need to come and see me because you're going to be symptomatic, and we need to talk about options. Anyway, and so this loop, the Mirena has a hormone in it, and it supposed to only be absorbed in the uterus, but it does get absorbed a little bit in the body, but very little. Okay, it does its thing right there in the lining on this mucus. Okay. The copper T has no hormones. It's got copper ions. And these copper ions are spermicidal, like the spermicidal lube we talked about. It kills the sperms, and it also makes the whole area, the lining inside, also not favorable for implantation. So, that's how it also works by preventing a pregnancy. It's a very good form of contraception. You can fall pregnant immediately if you take it out. So you insert it, the gynecologist can insert it in the rooms. If it's a bit too sore, it can be quite sore. We can take you for a day procedure in theater, or they can sedate you. We insert it quickly. We check once that it's in the right place with a scan. You're ready to go for 5 years.
Sure.
Great. You can take it out at any time before the 5 years, and you can fall pregnant immediately. It's very, very good at preventing pregnancy. Other forms that's also very good, which we call LARC, long-acting reversible contraceptives, are an injection.
Okay.
Also but that's hormones. Every there's a 2-month one and a 3-month one. You can use that one. And then there's an implant. The implant is a little plastic rod that you put in your arm, and it stays in there for 3 years. Same ingredient as the injection. It just stays there for 3 years.
Okay.
And also works very, very well to prevent pregnancy. Some people don't get a period, which is great and fine for them.
And it's reversible.
It's
so
reversible. The injection and the implant, women, usually their cycles take a bit longer, 3 to 6 months to really normalize. Just because the brain is not, has to get used to sort of, I'm not getting hormones anymore. Okay. And then it goes again. But yeah, usually even you can fall pregnant within a month also,
Yeah.
So it doesn't cause infertility. And then, of course, the pill you have to remember every day. You have to take it at the same time every day. If you forget 1 or 2, oopsie, you might ovulate, especially if you're like very fertile. And of course, we know if you take antibiotics, it's an issue depending on which antibiotics. So that's the downside of the pill. It does help for skin. So if somebody is, really struggling with hormonal, acne, acne is not necessarily hormonal, but it can be. Then, you can come and talk to to me or to your gynecologist, because then we can help you. It does help a lot of teenagers with acne, but that's not the only treatment for acne.
Okay. Yeah.
And then the permanent stuff is the vasectomy, snip for the men, a day procedure. It's not that painful. It's a little bit.
Yeah, I've got a mate of mine who had it
but
done.
It's fine.
He was at work
it's
the same
a
day.
smaller op than the female going for sterilization. Hers is actually you have to go
Yes.
into her abdomen and go and clip the tubes. We don't take the entire tube out. We just usually put a clip on there or a stitch on there, and this blocks the tube so that the egg and the sperm can't get to each other in the tube. But it's a bit of a little bit more risky than just a vasectomy. Vasectomy is actually much easier to do. So
what's the risk for the lady?
So just because they have to have an anesthetic, so there's risk with that.
Yeah.
And as you enter, we do it with keyhole surgery. So you go in, there's a little bit of bleeding, you're going in between bowels, so you could have a bowel injury, although the risk is very low, less than 1%. It's just a little bit more risky than just on the outside going into some skin and snipping. Yeah, basically.
Interesting.
But it's also, very safe. It's actually very safe.
Yeah.
So these are all the contraceptive. I mean, there may be other stuff also that I'm missing, but you get the natural methods, where withdrawal method, or you're not having sex in your fertile window, but these are not very good to prevent pregnancy.
Yeah.
So you can. So a lot of people do that with condoms, and they can avoid it, but it's not a very good form of contraception.
Yeah. It's such a. It's a whole thing. Like
it's massive.
Yeah, it's such a massive.
And I think men need to know about this.
Absolutely.
They need to be part of the conversation of contraception, of what are we doing, when are we, when are we doing it?
Yeah. Well, I mean, so there's a controversial psychologist who I love. His name is Jordan Peterson, and he talks a lot around relationship and whatnot. And he's a big advocate of sex. He's just
it's important for a relationship.
For a relationship, you're getting that bond. And he lays out this whole thing of number one, communication. He's the second you want to sweep something under the rug, that's the moment you have to now actually talk
unpack
about
it
and do it. And he's it's uncomfortable, but the more you do it, the better you get at it.
Definitely.
And he talks about just spending time, physical time. So he says you should spend 90 minutes a week minimum, face-to-face, one-on-one, no phones, no TV,
intimate
no anything.
Time talking.
Just talking. So you can be talking about Lego, that's fine.
Yeah.
But
connecting.
Yeah.
So interesting thing about sexology and how it differs in men and women, and I think we can touch on this quickly. It's very, very interesting. So men work differently. We know that. Men want more sex, and we always joke about it, but it works differently. You've got more, testosterone, much more testosterone than us, and usually you get the urge to have sex more frequently than women does.
Yes.
Okay, women, when they young and they've got lots of hormones in early teens and 20s, yes, then it's sort of the libido is there, the sex drive is there. But when we get a bit older, we see that actually psychologically it works differently. Women are not usually the ones that feel physically they have to initiate sex. And that is actually normal. There's nothing wrong with women if they don't feel every day, I'm less for sex, okay?
Yeah.
That's normal for women. What happens with women psychologically is they don't feel it, and then it becomes a cycle of, but I don't really feel like it. I'm just like neutral, because they're usually neutral, and men are not. Men are more prone to or want to. And then they're like, but I don't feel it.
Always pro, always. 24
Unless
hours
you're
a day,
asexual.
7 days a week.
So what happens is a woman say no because they don't feel like it yet.
Yes.
And then they say there's an issue with the sex or the sex drive. And usually what I say then is, you know what? You might not feel up to it, but usually I've always asked my patients, if you then sometimes say yes and you get into it, do you ever then not feel like it, feel like, oh my gosh, no? Of course, if you're upset, you've got a headache or whatever, don't even go there, guys. I mean, you must read your crowd, okay?
Yes.
Okay, you'll know, when it's really not time. But if it's like neutral, there's really nothing going on, it's 9 o'clock at night or morning, whatever, and she's like, I don't really know if I'm less, I always say to the woman, just go for it then. That's when you just go, because then as soon as the foreplay starts, then women get into it, and that's completely normal.
Fray a little bit,
and do that, but
fray a little bit,
but the men don't get upset if the women aren't initiating it. It's actually normal when you get a little bit older in your 30s,
and it's odd though, because guys enjoy when their woman initiates.
Of course.
It's a huge thing for guys.
Like, so women should try.
You feel like a salesman, right?
Yeah.
I mean, I think for myself, right? I do sales. Our first interaction was, you got referred to us.
Yes.
And next thing, Des is on the phone going, hey, sell. That's
and
what
I remember,
I do.
just quickly, I phoned you. I was like, okay, I need this by tomorrow. Or what did I say?
It was like 4 days.
Oh, I gave you like 4 days. I'm like, I need computers this week. I need stuff now. I'm sorry for the late call, but I only got the rooms now and I need them now.
It was only the Mac that was a bit of an issue.
Yeah,
that
it
I had
was
to
fine.
hunt for.
Of course, I wanted a Mac, but yeah.
So like for me at least, I'm a salesman. I sell all day. I don't want to go home and sell.
I understand.
So it is a tough one to get across. But once again, if you're communicating, and I love that you brought it up, because I wasn't really even thinking of that as part of the topic that we were going to talk about, but the communication is just so key.
Yeah.
I've got friends of mine that like mentored my wife and myself. So when we got married, we did a pre-marriage course, and we had a couple that are like massive in our lives.
Yes.
Like we love them to death.
Yes.
And they spent, I think it was 8 or 9 weeks.
Wow,
we did like a personality type test thing. So it's a marriage test, and you answer like 120 questions or whatever it is.
We also did that.
And then it spits out a bunch of stuff, and then they get to have a look at it, and they go, "Ooh, okay, cool. Des is a little bit like this, and Lee's a little bit like that, or there's a disconnect here, or look, they really
now
connected.
You understand.
You're here. They both want the same amount of kids, or whatever." And they've done this. Is Warren and Karen. I love them to death, and they've been married now. I think they said it's like 27 years or something like that.
Oh wow!
And for them, communication is something that they'll preach it from a mountaintop if they could. Communication, and they kind of have taken their marriage so seriously. So every single year they do some kind of a marriage course.
Oh wow!
Yeah,
that's amazing.
For 27 years,
that's amazing.
Every single
that's why
year,
they're still together.
Yeah, and they are one of the best couples. And I mean, it's this communication thing is just so key. But we don't want to do that because maybe it's uncomfortable. Maybe it's a bit
and some people, I think, it takes the spontaneity out of sex. Maybe,
sure, or maybe we're embarrassed. I mean, I remember when I was in my early 20s. I did not want to talk about periods and all that kind of jazz, and I didn't want to know about it. I'm like, your problem, you deal with it. 3 weeks of the month.
Let me know when I'm ready.
I'm there for you. Don't worry, kind of thing.
I think it's so good that that's changing, in today's day and age. I really, really think that men are coming towards, being open about stuff and talking about it. And yes, I know we know you have needs. Just talk about it. And I think if women say, listen, I mean, there's no such thing as you have to have sex every night or every second night. You know, I think it's very individualistic. You know, we need to every couple is different.
Yeah,
you know?
absolutely.
And what works for this couple wouldn't work for the next couple.
Yeah.
And so you need to figure out what works for the both of you.
Yeah.
And so women, I think it's good if you now and then can try and be the salesman or the saleswoman. But it's not abnormal for you to not feel in the mood as much as your husband. That is completely normal.
Yeah.
Women work, it is very much emotionally driven for you. And so, you know, also, if your husband or your boyfriend, your partner speaks nicely to you and helps a little bit in the house, of course you're gonna be like, why not? You know. And so, just guys, I'm just saying, you know. But it works both ways.
It does,
works.
Yeah.
It takes two to tango. It works both ways. You know, for other way around as well.
Yeah. Yeah. All right. What does it take? You mentioned 15 years of study, practice, all of this
almost,
kind of, and I always joke, and it's a funny joke. It's not. Oh, I don't mean it seriously, but I always go, "Jeez, man, look at these doctors, eh? They spend 15 years studying, and then they start practicing."
No, but we do clinical work from very early on. So in the hospital already, it's not like we only study.
No, I know that, but I'm just like this practice. It's a funny word, like, because, like, you know, you're going like,
practice.
okay, I'm learning guitar. I'm practicing. I'm not professional
now
yet.
I'm practicing medicine.
Yeah,
that is true. Like, that is true. And you call it a practice. Where's my practice?
Yes, yeah. So what does it take? Someone wants to become you. Some young lady or young guy wants to become a gynecologist or whatever. Like, what's the road? Yeah.
I mean, it's difficult to get into medical school, and I think if once you're in, you know, then it's not easy, but it's sort of less steep hill to go, because you can take it day by day. So you already need to start in your high school years, you know, even before matric. You know, you can't wake up in matric and say, oh, no, I want to study medicine. You know, from your first high school year, grade 8, 9, you already need to start doing well, you know, take the right subjects in maths and science,
biology.
You know, and biology if you can, and then, you know, if you well-rounded as well, you can do sports. It always helps, and then you need to apply and sort of start putting it out there and see. But it's very difficult. Different universities have different acceptance rates and blah blah blah. But I think so that's the thing, and you need to talk about it to your school counselors or people that are in the field or at the universities. Go and have the conversations early on about how can I get into medicine.
So you need to be intentional, like,
you need to. That's the word. You need to be intentional. Exactly. And then, I mean, once you're in, you just need to get through it. So you I mean, in my first year, I decided, okay, I worked very hard in high school, and I was like, you know what, I'm going to enjoy university a little bit. So I just passed. Okay, to be honest.
It happens so often with people.
I was just like, I'm just going to pass. Why must I get out? It's also very much more difficult to get 80% in university than at school. But really it is. So, but then I was just like, you know what? Yeah. So I enjoyed university. I passed. I did well at the end. And then it's 5 years or 6 years degree, where from the first, second year, you already start doing some clinical stuff, some stuff in the hospital or in like simulation labs and stuff, and you really just need to get through it. It feels like forever, but just get through that and take it day by day, term by term. You know, you can party when you party hard, that's fine, but when you have an exam coming up, you need to prep for it, because you're not going to enjoy it when you fail and you have to redo a year. It's really not ideal. It's also okay, you know. But then, if you really want to be a doctor, you're going to have to pass at some stage.
I don't want to be going to a doctor that's like having a chat, you know. It's like, I failed 2 years. 2 years.
But you wouldn't know, because people wouldn't ask. You're not going to ask. Maybe I failed. You didn't. You didn't know. I didn't. But I'm just saying.
But like that can be disconcerting, you know.
Yeah, but
it's like going. So this is, I mean, maybe a little bit on the edge of controversial, but it's like going to an overweight dietitian.
It's true.
You know?
Or going to a cardiologist that smokes. A lot of them smokes, by the way.
Yeah.
Anyway.
You check some bra out, he's puffing, and next thing you're sitting in front of him, and you're like, okay, cool, right, your heart
you're
is
and you're not allowed to smoke. I mean, it is true. I feel, that's why I feel like, for me, my lifestyle needs to show what I practice, what I preach, you know? So I'm very pro that. But anyway, so then you finish with your degree, and then when the first day when they tell you, hello, doctor, or, you know, it's like the best feeling in the world. If that was your dream. And I remember I was crying that day when I heard I passed all my final exams, and the professors all shake my hand, and they were like, hello, doctor, geluk, doctor, you know. And I was like, so congratulations, doctor, when they call you that. That was amazing, amazing, amazing achievement for me. in this time, actually, my first year, I lost my mom to cancer. So it was very difficult for me. But I did it. I don't know how, but I mean, I've got ovaries. I was strong, you know.
Very
So,
good.
yeah. So I did it. And then what you do is you do 2 years of internship where you work under supervision, usually at a hospital with more senior doctors, and you rotate through different departments. So general surgery, gynae, there. And then I wasn't really sure what I wanted to do, but I've always liked gynae. I was just in denial, I think, because we do work very hard and you heard a lot of negative things about it. But anyway, and then you do a third year after your studies, which is the ComServe, community service year. And that's where the government places you in a hospital. You can apply for 5 choices, but they all have to be in different provinces. They let you know literally.
Wow, different provinces?
Yes, they have to. Most people have to pick up and move within a day or two after your internship, because you still have to work as an intern and you only get like 2 days to move your whole life to whatever province. And then they usually place you in a smaller hospital. It's not usually big cities. It's much more difficult to get into because they need you in the rural areas. That's why you're doing community service. And then you work there more as a GP, but they call it a medical officer. And then I decided in my ComServe year, I was lucky I got into Stellenbosch Provincial Hospital. I did my ComServe there, and there I realized, okay, I really like gynae. And I said to my then fiance, now husband, listen, this is what I want to do. I know I said to you, if I tell you I want to do gynae, no, you're crazy. But he can't tell me that, of course, because we have a good relationship. But then he says, are you sure? And I said, yes. And so then I decided I applied for a medical officer or as a GP work in the department of gynae at Tygerberg. Luckily, I got a post there, worked like that for a year, started doing the exams, and then I started specializing. Then your specialization is 4 years. If you get into the program, some people wait many years to get into the specialization program. I was like, I waited a year and then I got in because I did some exams and everything beforehand. And I was in the system sort of there at Tygerberg already. So that helped a lot because they knew me, you know, they knew I could cope if I got into the program. So then it's 4 years. That's hectic. You do like twice, you do exams, you do like a research project where you try to publish, you know, your research work as part of your degree as well. And then after that, I decided, okay, I want to do the subspecialization in the gynaecology, and then it was another 2 years, and then I stayed straight.
You're a sucker for punishment, eh?
Jeez, I'm telling you, I finished the beginning of this year, or actually in May, only, and I think I'm done with studying for a while now.
Yes,
I'm quite tired.
Tell me, I got to experience this a little bit with you. Tell me, getting your practice set up, and your rooms there now, and I know you're not in a permanent spot.
Yeah, temporary rooms, and they're refurbishing my actual rooms.
Yes.
It's been lots of admin. It's like setting up a business. So I've not been, I've never had a business of my own, so I'm also learning as I go. I'm learning how to be a businesswoman, how to work with different service providers, how to set up stuff, how to set up IT stuff, which just, there's so much that you need to think of that you don't know.
Yeah.
But I'm figuring it out as I go along, and I'm set up now, and it's going well. Can't wait to move to my actual rooms. They're repainting and doing that, so that's going to be great.
Yeah. You're at Vincent Pallotti, yeah?
Live Vincent Pallotti, yes, yeah.
It's they've
got a very nice,
hospital.
oncology center there, so that's why it's perfect for me to be there. I've got my own practice there, but I work alongside a lot of other doctors and speciality, multidisciplinary, way of working, which is great.
Yeah. The feeling of accomplishment. So you've done 15 years of slog, and you've had to do your ComServe and maybe not the grandest of conditions.
No, not
it's
at
not
all.
like you're going to some fancy
It's
hospital.
Not Grey's Anatomy, guys.
Yeah.
It's not.
Yeah.
It's really not. It's not glamorous at all.
Yeah.
Really. It's nights and nights that you're awake, that you hate your life, that you think, why did I become a doctor sometimes? But you just have to get through it. And then when you, like you say, when you accomplish it, it's almost like unreal. Because it's like a dream that you thought, a nightmare sometimes, that you think will never end, but it does end.
Yes.
I always say
the light at the end of the tunnel wasn't a train, it was sunlight.
It was literally just not being in a hospital for 36 hours or 30 hours at a time, because that's many, many years. Every second weekend you're on call, in the week you're on call, you're up the whole night, your whole sleep rhythm is out, it really affects you. But it makes you, it made me stronger and a better doctor, definitely. Because you deal with hectic emergencies in those times, and that makes you even better, in what you do. And that's the reason why you're there as part of your training. And so you see the worst of the worst, and so you can handle, hopefully, anything, hopefully, that comes your way. But to get through it, it was difficult. Sometimes even my mental health struggled, to be honest. when it gets tough and you didn't sleep and you have to study and, you know, you see everybody in December holiday and I didn't have a December holiday for 10 years, you know, and you're in the hospital New Year's Eve, it's tough.
Yeah.
Right. But now I've made it through, and I always go by this quote, and maybe we should end off with this because I think it's a very good quote. Time will pass anyway if you think about your goals.
Yeah.
So you can decide what you want to do with your life every single day. When you get up, how am I going to spend my day? Okay. Yes, some days are harder and you just have to get through them if that's your goal, if that's what you want to do. Maybe it's not worth it, and that's also fine. You can do something else, right? But if it's something that you really want to do, get through it, do what you need to do, because time will pass anyway. In 10 years, you will wake up and you'll be like, oh, if I just stuck to it, if I just went through that, because my peers are there now and I just didn't, you know. And so that helps me. That motivated me to keep on going, you know, throughout all of this, because I knew time will pass anyway and I knew the end would come. When something gets difficult, luckily, it always comes to an end, you know.
That is fantastic.
Yeah.
All right. So the last question that I have for you is what does growing a pair, which you've answered a little bit of it already, but what does growing a pair mean to you?
Oh, yeah. It means standing up, getting up in the morning, even when the odds are against you. It means, you know, rising above whatever circumstances you're. I'm not saying that I wasn't born in Ukraine where there's bombs dropping next to me or whatever. I know that I was born into privilege or whatever. I can acknowledge that, and I think that's important. But, you know, still, when I lost my mom, I could have, you know, sort of said, you know what, this happened to me. I lost my mom at 18, 19, and why must I not do anything with my life? But I decided not to. I decided, you know what, I'm going to make her proud. I'm going to rise above my circumstances, above whatever happens to me. And I mean, that's even not the worst that can happen to anyone. You know, there's way worse things that has happened to people. And you hear of people that just, you know, make it such a positive thing of their lives. Motivational speakers that were almost murdered, you know, or whatever, or were addicts that came through it. And so you can always rise above your circumstances if you decide to. So that is what grow a pair of ovaries means to me.
Love it. Love it. Celeste, thank you so much, Dr. Celeste. Thank you so much.
Celeste. Thank you.
Really appreciate it. This has been I'm going to call this a masterclass on, you know, like, I don't know, so a masterclass something.
If it was good and, you know, if you get good feedback, let me know. We can chat again. If there's more stuff people want to know, they can just let me know and I can chat about it again. If there's something else, you know, that we maybe didn't cover.
Yes. Have you set up all your, like, social media stuff? Have you done all of that?
Yes, I actually have. Yes.
Good. Okay, so we'll get the links on that. We'll throw that all in
I'll give that to you.
In the description, and people
Facebook
can find
and
you.
And Instagram.
Oh, good. Fantastic. Awesome. Thank you so much.
Yeah, thanks.
Okay, man.
Thanks for having me.
Cheers, guys.